Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter's Medical School. He joins us from Bath. Doctor, thank you so much again. It's always a pleasure and very instructive to hear your analysis. And I want to ask you about what you think of this Berlin court order. It feels a bit confusing because the ruling says there's no reason for bars and restaurants in Berlin to close between 11 p.m. and 6 a.m. because it's not apparent such a curfew will help fight the spread of the coronavirus. I thought the understanding was that indoor social activities are dangerous.
Yes, thank you. So this is a refusal to look at the evidence and make the conclusions. Whilst people would like to deny it, it is undeniable that wherever people congregate, transmission of infection from other groups of people happen. So it can be the bar, the restaurant, or shopping center, places where other groups of people are congregating. This is important. So if you keep within your group, it's okay. But as soon as you go to, say, a bar or a restaurant, you are in your group, very close to another group, and if you spend close proximal time with them, especially if there is poor ventilation, you may get infected. This is important.
Okay, so we're looking at legal difficulties, we're looking obviously at medical problems, the virus has also been politicized. There's an incredible array of different factors that have to be taken into account. When you look at what's happening in the European Union and across Europe as a whole, what would your recommendation be in terms of borders and people crossing from one territory to another, not necessarily within one nation?
So because we've tried so many options and most of them have not worked, my view now is that each and every individual themselves, so you don't get infected, you don't infect others, and we need to push the correct infection control, protect your health messages. And if every single person did their little contribution, the effect is it's multiplied, it's magnified, and you can bring case numbers down, but only if every single person works hard on this. Then you take it a step further, which is you find the hotspots, the areas where you drop your guard. So you're having a drink of alcohol, that sort of thing, you get carried away, and then you drop your guard, you don't wear your mask properly, you stop all those sort of risky behaviors. That way we can go forward. Otherwise, we're just going to be living within closed borders, closed restaurants, closed everything, and that's not sustainable.
But doesn't it become confusing if we as individuals have to take care of our own safety? Doesn't it become confusing for people because of the mixed messages that so many governments are giving out? Because, for example, in the UK, you have this three-tier system now of 1, 2, 3, 3 being the most severe sort of lockdown. But then you have also examples of places that are in partial lockdown where you can go possibly to a pub which serves some sort of, what is the phrase the British government used? Substantial meal. So because you can eat there, they think you can be safe. I don't get it at all.
I totally agree with you, and I live in the United Kingdom, and I don't get it either, because I feel, so does that make it safe? Of course it doesn't. Just as the group of 6, so people take that to read as mingling with 6 people is fine. It is not fine. Mingling with other people, even 2 or 3, is unsafe. So what you do, the simple message is very simple. Don't get infected. Know the biology of the virus. Take precautions against it. You can change your behaviors. The virus doesn't change its behavior. You do it. And you have that short, sharp, consistent message, which is protect yourself, because if you become ill, you may get severe illness, you may die, you may recover, and if you recover, some of you may also have severe illnesses to follow. So all those simple messages need to be got out, and we will get there better if we do that.
What do you think is coming for the Northern Hemisphere's winter?
I'm very concerned because, of course, it's cold and it's dark and we are more indoors and we are not paying enough attention to looking after those simple infection control measures that all of us can take. So I am concerned. And therefore, my other advice is, listen, we do what we can do. So at least go and get your influenza vaccines to protect yourself against flu, whilst we've already got the coronavirus, against which we can only take infection control measures.
Absolutely. Dr. Bharat
Thank you.
Pankhania, thank you so much. Have a good weekend.